Hi, I'm Dr. Faranak Kamangar, and welcome to the Future of Dermatology podcast. We're here to talk about the real science behind skin, the medical breakthroughs, the cosmetic innovations, and everything in between.
Well, hello. I'm so excited for today's episode. We are back with Dr. Hadar Lev-tov, who needs no introduction to this group, but he is the Associate Professor at University of Miami Department of Dermatology and the Director of the Wound Healing Fellowship. He's also the Director of the Miami HS, or Hidradenitis Suppurativa Center, and an immediate past President of the Hidradenitis Suppurativa Foundation. I'm so happy you're here today because we really have so many updates in the HS world. So, Dr.
Yeah,
Lev-tov, just take it away. Tell us everything we need to
yeah,
know about
sure.
this really important condition.
Yeah, so I think the audience needs no introduction to HS, but I'll suffice it to say it's probably the most common disease you've never heard about is what you tell your patients, right? Or people who ask you, what is that thing, right? So I think really important to remember that these patients go through a lot. And I think I want to start with a tip is to just tell your patients when they walk through the door, I understand what you're going through. Okay. Just understand that. I think that will remove a huge chip off their shoulders and they'll be able to really communicate with you because let's face it, they are going through a lot and have been kind of, used and abused by the system, if you will. They're going through many, many doctors and finally they came to see you. You are their VIP. So behave like one and just tell them you get it. And I think you'll find that the consult will move much faster. Maybe we should start with treatment because I think everybody wants to know what's going on in treatment for HS. And boy, we talk about pipelines. Faranak, it's a fire hose that's coming at us. Okay, it's really, really hard to keep track. But we do have the approved treatments right now, which are, as you know, Bimekizumab and Secukinumab, which are the IL-17 inhibitors. But we also have a good old Adalimumab that is available now and also available as biosimilars. And while we don't have randomized controlled trials to compare to the biosimilars, I can tell you that all clinical experts are using it just the same. So, if you get that rejection on your, on your prior authorization and it says substitute, go for it. Substitute. It's fine. Some of us are using Infliximab if we have access. That is used off-label as an infusion, another TNF that's really useful for those really cases that are severe. You're like, I don't know what to throw at them. Infliximab, it's weight-based dosing, which is really helpful. And you can go up with the dose. You can go up with the frequency. In fact, we had some anecdotal reports in the literature for using up to 15 milligram per kilogram every 3 weeks. Okay, that's a lot of Infliximab. It's also a lot on the patient. And just this week, actually, a paper came out talking about the experience of using subcutaneous Infliximab. So here's a new pearl for you. And believe it or not, it is available in the United States. It is off-label in the US. It's available for Crohn's disease, and there's only one dose. It's only 120 milligrams. So, but in Europe, it's been around for a while. So we have just published, I think last week, some series from a multiple group in France, and they use 120 and 240 to have those two doses. But suffice it to say, it's off-label. So if your patient can tolerate the infusions, maybe you can do it. And the way to do it is you start week 0, 2, and 6 as you would regular Infliximab, but then you switch at week 10 quickly to every 2 weeks of subcutaneous injections. Now, again, it's off-label, and I think the takeaway from that paper is that you should do it only when the patients really are in good remission. So they use the one scoring system called IHS4, and in that scoring system, people had very little disease. We're talking like one abscess left. Okay, so just keep that in mind that they have to really respond well to the IV therapy. So if I were to do it again off-label, I would give them really strong doses of the IV until I really see good remission and then offer them the convenience of that, of course, if the insurance will cover. So this is kind of covering what's out there right now. Another off-label use is now, and now we're kind of veering to off-label and that are in clinical trials, actually. So Remibrutinib, that we know now is approved for chronic spontaneous urticaria, completed phase 3 of NHS and looking really, really good. We also have Povorcitinib, which is the JAK1 inhibitor, also completed clinical trials, phase 3, and reported, and they're looking good. So they're, I think, going to move on for application with FDA. And last but not least, and we're not going in any particular order, is Sonelokimab, which is a cool molecule. It's also IL-17 A and F inhibitor, but this is a cool new thing that we're, I think, going to see a lot in dermatology. These are the nanobodies. So here, we are used to the usual immunoglobulin kind of molecule, but here they're taking a smaller piece of that that actually you can find in camels and cameloids, and you take those and you can actually play like it's like a puzzle, right? So you take one piece for the IL-17A, one piece for the IL-17F. You kind of put them together. In this particular case, they threw in an albumin so it can stay in the blood longer. And now you have this like 3-piece molecule that's gone out there, these nanobodies. So they showed good evidence as well. So, I'm expecting that they will be approved as well. So you have those three, and then upadacitinib that some of us may use off-label is also going through clinical trials. So we're looking forward for that to come through. And there are multiple phase 2s that are ongoing as we speak, including cool things like half-life extenders. So we're seeing that coming in psoriasis and will come also in HS, meaning one injection a year maybe, right? Those kind of medications are coming through. So the pipeline is loaded. Super excited. Just keep track. Come
Right.
to Faranak podcast to learn every month of something new. So that's.
I feel like you have to come back every month. At the rate that things are coming out, it's incredible. The science is incredible. What's happening? You're talking about the nanobodies. We had like in the psoriasis world, we have peptide oral biologics now. The half-lives are extending. I mean, we might not necessarily be curing conditions, but if you take something once a year and you don't have to think about it again, we're kind of almost there in a way. The pipeline is incredible. Thank you for rapid fire review of it. And if you could just do that for us every 2 weeks, we'd highly appreciate it.
I wish we have so much every 2 weeks, but maybe, and I'd love to. But, speaking of curing inflammatory diseases, just come to my mind.
Yeah.
We are looking now at CAR T-cell therapy.
That's right. We could possibly cure it too. Yes. Exactly, please talk about this.
So that's exciting. I think most of the studies are in lupus right now, but once we find diseases in skin that are really, or maybe in rheumatoid arthritis as well, once we find good targets, I think that kind of what we used to think just a year ago is dramatic treatment. They may make the protocols a little more conducive to make what inflammatory disease kind of steal from the cancer world. So that's really exciting. Speaking of science, you mentioned science. I want to, maybe some of you listeners are interested in doing science, doing research, and it's important to know that there is money out there for research. So sure, you can ask your local MSL from any company that deals with HS. They may have some funds to do that. And I think they're really eager to get data and get you engaged. So if you want to do that, that's good. But you should know that the HS Foundation has the largest portfolio of different offerings to support any kind of work. Actually, if you want to learn from an expert, they give you like a small grant. I think it's like $3,000 or $4,000 or $5,000 to just travel and study with the greats like Chris Syed in North Carolina, or Haley Nayak in UCSF, or anyone.
Or yourself.
Yes, come to Miami, sure. But it really gives you, just what you need to cover travel. So if you're a young dermatologist out there and want to learn more, they'll pair you up with that. But also doing serious research. The funding now is not so great. I'll get to NIH in a second. So anything you can get is great. And now we have career development awards that the Derm Foundation together with the HS Foundation is putting together. And then the HS Foundation also, you can go to their website and find their different offerings for research. So they can support your research. And I think it's cool. And by the way, the HS Foundation website has a ton of tools. You can find a clinic. There's a clinic finder there. So if you need to refer, but also they have now a new feature, which is a wound clinic referral service. So if you are, my patient needs wound care, who do I go to? Click, and you'll see it there. That's that. If you're a resident listening, they have the HS Academy, which is a free weekend to just learn HS. They'll pay for your travel. They pay for your hotel, everything. Just come and listen to world experts speak to you about HS, and you'll be ready for your first day out of residency. I think you should check it out, because the registration, it runs out in like a week. Okay. So then on the way, people get that email. Oh yeah. Very, very popular. So really a lot of opportunities to do research, to train yourself, to learn. On the website also, they have prior auth templates. So I just mentioned all these medications, some of them on label, off label. How do you get them? Don't worry. Go to the website, you click on the prior auth link, and literally one click opens a Word document that's right there. I know, Frank, in your AI stuff, everything is happening much faster, but but this is
But it's incredible because you don't have to necessarily, because in AI, you always have to trust but verify. Here, you don't have to verify. It's come from the experts. It's in there,
totally.
ready to go.
It's totally there for you. Yeah, and all the citations, everything. You just plug in the names and all that, and your staff will love you for that. Okay, one last thing I want to share, which I think is a really, really, really cool paper that I read this past year. It came out, I think, maybe 6 months ago. So this is from, it is rare in dermatology that we get like publications in like Nature, right? So this is in, or Science or Cell. So this is, I'm not surprised, Luis Garza at Hopkins. What a genius, right? So this guy has been doing multiple works in wound healing, and all of a sudden he gets a Nature communication paper in Nature. I'm sorry, on HS, which really I was like, oh my God, I knew you know a lot about HS, but wow, this kind of works. So I'll tell you, I'm building here detention on purpose, but I think it's really key that we as dermatology really celebrate these kind of successes because, dermatology a lot of times has been put by the wayside because, oh, it's just a skin rash and all that. But now we know the impact on our patients. But when we can also show that we have this amazing science, I think it really kind of puts us right there, front and center in the house of medicine. So go and check this out. Here's what it's about. I'll give you the title. I put it up because I think, some of these things can be complicated. But basically, the title goes, Plastic-Associated Endocrine Disruptors Reduce Nicastrin Protein and Potentiate Inflammation in HS. And really what they have been able to show is that microplastics, which are really tiny, tiny pieces of plastics that are surrounding us, usually from low quality plastics, so don't freak out now, but usually the low plastic kind of plastics that are in our environment, they will usually find their way into our food and into our environment, and they're maybe in clothing. And if what was surprising to me is that first, they show that you can find it in their controls, actually, in normal people, in their skin, you can find microplastics in your skin. So maybe not huge news, but to me, it was like, wow. Okay,
Yeah,
these things
that's
are
news
out
to
there.
me.
Yeah. Now, we have a lot of stuff that we can find on our skin, I'm sure. But the question is, what do they actually do? And so they actually took it to the next level by looking at these microplastics that are endocrine disruptors. So those act like endocrine mimickers. They trigger some kind of a hormonal response. And they showed both in skin of patients that they excised and did experiments, but in also other models and other very sophisticated ways, that basically these microplastics are able to block Nicastrin in fibroblasts and really potentiate the process of inflammatory HS, which is like, remarkable. Okay. Now, I want to be careful. I don't think they're saying, and I'm not reading this to say microplastics cause HS. Okay.
Right.
We're not there yet. Okay. But it seems like there's mounting evidence in other disease states that these microplastics are not just kind of sitting there doing nothing. And certain subsets of these can be endocrine disruptors and maybe even be part or potentiate our risks for certain diseases. And now HS is coming under that big umbrella. So the other thing that was cool for me as a wound healing guy is to hear that it's not just immune cells, it's those fibroblasts. Now we know the keratinocytes, but the fibroblasts are part of this. And it makes sense. This disease scars horribly, right?
Yes.
So, and we see these really strange rope-like scars that we don't see in any other disease. No wounds really heal like that. So it is really, I thought was really cool that a lot of the work they showed there was in fibroblasts, which is, is music to my ears as a wound healing guy. But this is kind of just a brief introduction. Hopefully we could post the link there or just email Lewis. He's super accessible. He's one of our geniuses up at Hopkins doing amazing work and still seeing patients. So I think it's really cool that he is able to manage a lab that can publish in Nature Communications on one hand, but also see our patients on the other. So really true clinician-scientist. All those we should really, truly celebrate in dermatology.
Oh, absolutely. Thank you so much for that rapid review. I am going to do a deep dive on that last article because, like you said, it's not meant to be taken as, I feel like media sometimes takes articles like this and will blast some topic, a topic on it. And it's not really, the importance is not that, causal, all of that, but the importance is how advanced the science is getting and how much more we're understanding. And I love how you touched about dermatology, and we've talked in this podcast too that we're less than 2% of the house of medicine, and so sometimes there's implications of that. But when you think about the breadth of science that comes out from derm, because we just have access to our organ, and also because dermatologists are really smart and do a lot of great research, but
Yeah.
the amount of links and things that come out and help with even other disorders is really incredible. So I love that you touched on just the importance of derm science.
Yes, and not exemplified in this case, but we're also, in my case, but we're also the best looking doctors as well.
Yes, yes.
That's
And
right,
you'll
right?
never know how old we are. I mean, that's the other thing. And I do
No
have to
clue.
ask about, everyone's always also asking, we're understanding so much more about endocrine, metabolics. What's happening in your clinic with the GLPs and HS? Like, are you writing them first line? Like, what's going on with that in the
Oh,
pipeline?
wow. Okay. So,
Well,
yeah,
quick 30-second on
I'll give
GLPs.
I'll
This
give
is
you
probably
my
a
take.
2-hour conversation.
Yeah, no, I'll give you my take on that. Is that I think the jury is still out. So,
Okay.
direct impact on HS. So I think that, I think there's no question in my mind that these medications are profoundly affecting the human body in many different ways, and the skin being, a significant part of uh, our body and our health is just joining the ride. But to me, I think the data is, and we published a little bit on this as well. But I think we don't have a direct kind of study like a randomized controlled trial on this. We have anecdotal observation. Now, sure, if you are improving your metabolism, if you are lowering your weight and all that, there is a correlation between HS and obesity. So there's a reason to think that you will do better. To tell you that I'm putting that as a monotherapy for my patients, no. And I can tell you that I'm here in Miami. Everybody's on GLP-1, so we're right.
They're on it anyway when they come in. They're already on it when they come in.
You're already on it. And I've seen it go both ways. So, you can think of someone who's obese and losing weight quickly, that you increase the areas of friction, and now they get these nodular disease in those areas that I think they didn't have before. So I've seen it go both ways. Definitely people who think they're improving, but they're also on other therapies. So what does that mean? So to me, when a patient comes in and says, I want to get on a GLP-1, I say, okay, first you get on a biologic. And once your disease is stable, we'll work on that. Because I think, to me, prescribing a GLP-1 has to come with a resistance training plan, with a diet plan. I mean, this is not just you give them a prescription and walk out the door. I got to tell you something funny, though, okay? Because this is hilarious. You probably had a patient, and your listeners, right, who a patient come in, horrible psoriasis head to toe, bad HS, bad eczema. You start talking about a biologic, right? You spend 15 minutes, like, listen, I know it's immune modulating, it's immune suppressive, you have all this. They're like, I don't know, I'm going to think about it, I'm going to read about it. And then you say, okay, read about it, I'll give you some information. And you walk out the door. And as you get to the doorknob, what do you hear? Hey, doc, can you just write for me a GLP-1 injection? And in my mind,
100%.
it's like, right, this is happening in
Yes.
treatment rooms all over the country.
All over the
And
country.
in my mind, GLP-1 is profoundly changing your body much more than a biologic. I mean, if you look at an
Yes.
IL-23, I mean,
That's
it is
like what you're talking about is so specific versus the GLPs touching all these different organs and all these different parts of the body.
And people are willing to make that commitment just like that. So I think there's a lesson there. I don't want to be the person who's drawing all the lessons, but I can tell you, to me, there's a lesson there that we may need to prioritize, because people they're doing this because they prioritize weight, and it's so it impacts their life so much that they feel like they're reaching out to the dermatologist. Please just write this for me, right? And I think we need to also let our patients know that their skin disease is definitely just as important, and work like that. Anyways, but I know what you're going to ask me, because I know you ask all your guests right before the time is up, right?
Yes. We always ask about, this is the Future of Dermatology podcast. We have to ask what you're excited about for the future.
Yeah, so I wasn't ready for the GLP-1 question, but what I'm excited about is actually very similar to that, and I'll tell you what it is. Because I think everybody's probably nervous thinking about AI and all that. I'll tell you, I'm actually excited about getting good treatments that allow us to be doctors again. Okay. So I want to, we'll take the psoriasis patient, for example, that is on a good biologic. They come in a year later, they're totally clear. And we say, okay, what are we talking about now? We have like 10 minutes. 15 minutes. What should we talk about, right? And I think I'm so excited that this will happen in urticaria and vitiligo and alopecia and, of course, HS. And, we're doing this a lot in eczema and psoriasis. What are we going to talk about? And I'm really, really looking forward to kind of us becoming almost like lifestyle doctors, where we can talk about GLP-1s, where we talk about exercise and talk about nutrition in a good, healthy way, right? Talk about the mind-body connection and the mind-skin connection. So really, I'm looking to see more research coming out on that. We're doing some work now on exercise. Hopefully, we'll have the data to show in HS. We got a grant from the HS Foundation to study this in an exercise program and kind of how do we really prescribe this is specific for people with HS. But I think all of us are now getting these questions. And I think the GLP-1s brought to the fore the discussion about wellness. I think this also traces back probably to COVID. People realize if you want to survive, you got to be healthy. You can't just let yourself go. And so I think that's what I'm excited about. Our treatment's getting better and better. And even with the limited time and managed care and all this pressure that, these people are putting on us, maybe we'll have a little corner of time, a little nugget of time to really connect to our patients, to really talk to them about lifestyle and what they care about. Yeah. So that's what I'm excited about.
I love that because we've actually talked about on this podcast a lot about AI is going to buy all this time back for you. And people say, well, you're going to then do some more complex things with that time. And what are those things that you'll fill your time with? And I love this as a proposal of this is what you do. You talk about holistically, which is why we need to go to your integrative conferences and talks. And I learned so much. I learned so much at the last integrative conference. I'm not saying it right. What is the full name of the conference?
So, thank you. So this is the Integrative Dermatology Symposium. Yeah. And it's the first of its kind. We're going almost a decade now. Really proud of the community we created. So if you want to find docs, dermatologists like you and I who want to think a little outside the box, we welcome use of medication. This is not like a voodoo kind of treatment. We actually have all the drugs that you would expect to see in a regular dermatology meeting. But we go beyond. We talk about exercise, nutrition. We have a medical chef on stage doing demonstration, and you can communicate with these people and talk to them and see how can I add that to this practice. So if you're in a competitive environment, right? If you're a dermatologist in Manhattan, there's like 3 dermatologists on every block. How do you, separate yourself from the pack? Well, what you get another skill. And if this is something that you are interested in, check it out. The website to go is Integrative Dermatology Symposium.com, or just go to LearnSkin, which is the parent company that runs this. LearnSkin.com, you can do that, and has other offerings. And we actually have a certificate program for dermatologists as well, if they want to do it. So it's a more intensive program. It's only for board-certified dermatologists, but you get really good at this stuff.
That's amazing. We'll put that in the show notes as well. I had the chance to go to the conference this year, and it was fantastic. So everyone should go. Everyone should find a time to go. Well, thank you so much for keeping us all updated on HS. And if you can come back every month, that would just be great. There's too many things happening. There's too many things in the pipeline. So thank you so much, Dr. Lev-tov.
Of course. Thank you for having me.
Thanks for joining us today on the Future of Dermatology podcast. If you enjoyed learning about the science behind skin, make sure to subscribe, and we'll see you next time. As a reminder, this podcast is for educational purposes only, not for medical advice. Always consult your healthcare provider.